patient's care plan. The patient's care plan is individualized for each patient based on his/her needs in long-term care and home health care services. It is developed to achieve the goals of care provided to the patient. It lists tasks that home health aides must perform. It states how often these tasks should be performed for the patient and how they should be carried out by the home health aide. The care plan is a guide to help the patient attain and maintain the best possible level of health and daily function. It must be followed very carefully. Activities not listed on the care plan should not be performed. However, it is ultimately important for an home health aide to make observations and report all changes to the coordinator in the agency. The information collected will be used to determine how the patient's care plan needs to change and meet ongoing needs. Care planning involves input from the patient and his/her family, as well as from all healthcare professionals providing care and health services to this patient. When the patient is involved in care planning, he/she is more likely to participate in his/her own care and continue the prescribed treatment and home care services. In addition, each patient has a legal right to participate in his/her own care process by making choices, decisions and preferences as of how care should be delivered. When the care plan is created, the patient is assessed for his/her physical, mental, psychological, functional and socioeconomic needs, as well as ability and the level of assistance required in performance of different activities of daily living. Then, a nurse will elaborate the care plan tasks that can help the patient achieve his/her goals of care, priorities and expectations, maximizing independence and self-care. The care plan is prepared by the nurse at initial admission of the patient and then every 6 months. The care plan may be updated more frequently, if the patient's condition or home care needs have changed. There will be one care plan for an home health aide to follow. Home health aide follows the patient's care plan and carries out instructions given by a nurse. The nurse is acting on the recommendations of the patient's doctor. This is called the chain of command. It describes the line of authority and helps to make sure that patients get proper health care. It also protects employees and the agency from liability, the legal term that means someone can be held responsible for harming someone else. For example, if an home health aide does something not in the care plan that harms a patient, he/she could be held responsible. That is why it is always important to carry out instructions in the patient's care plan and follow the chain of command in the agency by reporting and communicating changes in the patient's health, functional status, mental status and so on. Other reportable events include hospitalizations, falls, bed sores, abuse, neglect, etc. Home health aides must understand what they can and cannot do. It is necessary, so that they do not harm patients, protect themselves and do not involve themselves in lawsuits. The care plan provides you all necessary instructions for giving proper care to the patient. You should read the care plan at the beginning of your work shift, even if you read it before, to check if there have been any recent changes to the patient's care. Call the agency's office at 347-492-5982 if you may have any questions about the care plan. Call the agency's office at 347-492-5982 if you are unable to locate the care plan in the patient's home. Perform only the tasks that are checked on the care plan. Notify the agency's office at 347-492-5982 if the patient requests anything not listed on the care plan, or if you are not knowledgeable or comfortable to perform the assigned care. Following the care plan means that you provide care as directed and that you will be able to report any problems or concerns related to the patient's care. It is the policy of First Choice Home Care Services, Incorporated, to comply with all applicable laws that require records to be maintained of the hours worked by our employees. Your record of work hours is the way of communicating to the agency on what days you provided care to the patient, how many hours you worked for the patient, and what care tasks you performed for the patient. You must follow the patient's care plan. Document only the tasks that were actually performed and only the actual times and days when the services were provided to the patient. You must notify your coordinator if the patient may refuse any task on the care plan or may refuse the services completely. Your work record is considered a legal record of care provided to the patient. It is a permanent part of the patient's chart. It can be used as an evidence in a court of law. It helps the agency to receive the payment for services. It helps the agency process your weekly pay for the hours worked in a timely manner, so you can receive the payment on your check for all the hours you worked without any delays. Inaccurate and incomplete documentation, or your failure to provide records of your work hours on time can delay processing or cause inconsistencies in your weekly paycheck. The 21st Century Cures Act is a federal law passed by Congress in December 2016. It requires all state Medicaid programs to implement an F system for personal care services, PCS, and home health care services, HHCS. Beginning January 1, 2021, all New York State providers must implement an F system to avoid a reduction in federal Medicaid funding, and all New York State service recipients must comply with the F requirements of the New York State Department of Health (NYSDO) to validate their work hours on a real-time basis. As of January 1, 2021, as per directions of the NYSDO and Medicaid, all home health aides will be required to clock in and clock out when they start and finish work for patients. You must use electronic visit verification (EV) system, or you must install a mobile app on your phone that can also be used for clock in and clock out. Both EV and mobile app features are maintained by Home Health Aid Exchange, a software approved by the NYSDO and currently used by First Choice Home Care Services, Incorporated. If you are already clocking in and out for work, you do not need to take any further action. If you are not clocking in and out and require training or installation of a mobile app, you should contact the agency's office at 347-492-5982, so we can help you arrange the necessary training or installation of the app. Beginning January 1, 2021, home health aides must record their work time by clocking in and out or using a mobile app. Clock in and out instructions, as well as mobile app instructions, are available in the agency. If you may require training or need a copy of the instructions, you must call the agency as soon as possible. The agency will stop accepting paper time sheets as of January 1, 2021. To receive your paycheck on time and prevent any delays, you must clock in and out for work, or use a mobile app on your phone to record your work hours. If you select the EV option, you must only use the patient's phone to clock in and clock out for work. You are not permitted to use your personal phone for clock in and clock out. First Choice Home Care Services, Incorporated strongly recommends home health aides to begin clocking in and clocking out for work before January 1, 2021. If you may need any additional instruction how to clock in and clock out or use a mobile app for recording your work hours, please call the agency's office at 347-492-5982 and speak to your coordinator or HR department. No. Reporting. When making any kind of report, the right kind of information must be collected before documenting it. Facts, not opinions, are most useful to the agency's personnel and the care team. Two kinds of information are needed in reporting. 1. Objective information. This information is based on what a person sees, smells, touches or hears. Objective information is collected by using the senses. It is also called signs. Objective observations made with your eyes, what you can see. Skin, color, bruising, swelling. Bowel, color, amount, consistency. Urine, color, amount, frequency. Facial expressions, grimacing, crying. Any changes in patient's appearance. Objective observations made with your nose, what you can smell. Body or breath odor. Environment, such as unusual chemical odor or gas leak. Objective observations made with your fingers, what you can feel by touch. Skin temperature. Pulse. Objective observations based on what you can hear: patient's words, tone of voice, breathing. Null.